Several national guidelines recommend continuous use of antipsychotic medication after a psychotic episode in order to minimize the risk of relapse. However, some studies have identified a subgroup of patients who obtain remission of psychotic symptoms while not being on antipsychotic medication for a period of time. This study investigated the long-term outcome and characteristics of patients in remission of psychotic symptoms with no use of antipsychotic medication at the 10-year follow-up. Methods. The study was a cohort study including 496 patients diagnosed with schizophrenia spectrum disorders, ICD-10, F20, and F22-29. Patients were included in the Danish OPUS trial and followed up 10 years after inclusion, where patient data was collected on socio-demographic factors, psychopathology, level of functioning, and medication. Findings. 61% of the patients from the original cohort attended the 10-year follow-up, and 30% of these had remission of psychotic symptoms at the time of the 10-year follow-up with no current use of antipsychotic medication. This outcome was associated with female gender, high GAF-F score, participation in the labor market, and absence of substance abuse. Conclusion. Our results describe a subgroup of patients who obtained remission while not being on antipsychotic medication at the 10-year follow-up. The finding calls for further investigation on a more individualized approach to long-term treatment with antipsychotic medication.
Introduction.
Several national guidelines recommend continuous use of antipsychotic medication after a psychotic episode in order to minimize the risk of relapse. This study investigated the long-term outcome and characteristics of patients in remission of psychotic symptoms with no use of antipsychotic medication at the 10-year follow-up. Findings. 61% of the patients from the original cohort attended the 10-year follow-up, and 30% of these had remission of psychotic symptoms at the time of the 10-year follow-up with no current use of antipsychotic medication. This outcome was associated with female gender, high GAF-F score, participation in the labor market, and absence of substance abuse. No consensus exists on the optimal duration of antipsychotic medication after remission of psychotic symptoms, but there is a tendency towards recommending long-term treatment. Takeuchi et al., 2012, Hassan et al., 2013, Leucht et al., 2012. The 7-year follow-up showed no significant difference in relapse rate between patients on antipsychotic medication and patients who completed discontinuation or dose reduction. Wunderink et al., 2013.
Objectives.
The purpose of this study is to examine the proportion of patients who did not receive antipsychotic medication at the 10-year follow-up and who at the same time had remission of psychotic symptoms. We aim to identify different characteristics associated with this favorable outcome. Methods. This study was based on data from the Danish OPUS-cohort, consisting of 578 patients aged between 18 and 45 years and diagnosed with psychotic illness, i.e. within the F20-F29 spectrum according to the ICD-10. Patients with a diagnosis of schizotypal disorder were excluded from the dataset, given that the main focus of this study is on psychotic illness, resulting in a study population of 496 patients. The recruitment took place in 1998-2000, where individuals with a first episode psychosis were included from major public psychiatric centers in Copenhagen and Aarhus, Denmark. The participants were considered representative of patients with first episode psychosis since 90% Aarhus and 63% Copenhagen. Of all patients from the catchment areas with a registered first episode psychosis were included in the trial. Peterson et al. 2005, Bertelsen et al. 2008. Results? At the 10-year follow-up, 303 patients participated, resulting in a follow-up rate on 61%. At the 10-year follow-up, 33 were deceased, and 18 had emigrated, and when excluding these patients, the follow-up rate was 68%. Austin et al. 2013. At the time of the baseline inclusion, participants had an average age of 26.3 years, 55.4% were male, and the majority of the patients were diagnosed with schizophrenia, 79.2%, whereas the remaining participants were diagnosed with different psychotic disorders, primarily acute and transient psychotic disorders, 8.9%, and delusional disorder, 5.9%. Table 2. There were no significant differences between non-participants and participants at the 10-year follow-up regarding gender, presence of substance abuse, or diagnosis at baseline. We did find that patients participating in the 10-year follow-up both had a significantly higher baseline GAF score and were significantly younger than the non-participants. Discussion. Numerous cohort studies have examined the long-term outcome in patients with psychotic illness. including remission of psychotic symptoms, but few have investigated its correlation with antipsychotic medication. Harrison et al., 2001. Robinson et al., 2004. In the much larger ESOP-10 study, NH412 patients, 101 out of 228 patients with first episode non-affective psychosis had symptom recovery at the 10-year follow-up, whereas only around half of this recovery group, 56%, were prescribed antipsychotic medication.
Conclusion.
We found that 10 years after being diagnosed with a first episode of psychosis, almost a third of the patients achieved remission of psychotic symptoms and at the same time did not use antipsychotic medication at the time of the follow-up. Female gender, absence of substance abuse, high GAF-F, and having a job were significantly associated with a favorable long-term outcome. The fact that such a large proportion of patients was in the remitted-off medication group after 10 years emphasizes the heterogeneity of the course of psychotic illness and that the present medication guidelines do not cover all subgroups.